For Wall Street Media, this is Sherry, and I'm here with Doug, and we'll help you make money in the stock market. We have information you can't find anywhere else, and here's Doug to tell you more.
Hey, we've got the Leerink stuff. Sherry came in. Special. You do have a medical degree, right?
I do.
And we appreciate that because we're going to have you evaluate the compounds.
I went to medical school for 10 years.
Did you? Yes. Super fantastic because we have Biotechs. Conquering Cancer with Novel Therapeutics, Leerink Swann. And we have highlights. What do you have for us?
Yes, we do. Dr. Jane Green, VP of Corporate Development for Cosm Biosciences, and that's ticker KOSN, talked about each drug they have in the pipeline, highlighting their drug KOS 1584, for which a phase 2 trial in non-small cell lung cancer has been initiated. And they believe that KOS 1584 has potential to treat solid tumors as well as breast and ovarian cancers. They look to have data from the first part of this trial at the end of 2008.
Yeah, there's a lot of exciting stuff. I listened to all this morning's presentations. I didn't get to Cosm yet.
Yeah.
And I was really fascinated with some of these. It's just so nice because it's been 25 years that the biotechs have been up and working and in the public limelight. And it seems like some of them are getting so close now.
And it's really important to me, too. Actually, my mother and her sister are both survivors. My mom was diagnosed in 1985, and so all of this is just amazing to me. And
yeah, good stuff, right? Good news.
Definitely. We also have Robert Conway. He's the CEO of Array Biopharma. That's ticker ARRY. Talked about the company's 10 compounds in development, 6 of which are 100% Array-owned. He talked specifically about the ARRY 797 Phase 2 inflammatory pain clinical trial. And that was announced yesterday that the 200 and 400 meg doses saw dramatic reduction in pain over 6 hours. Conway also announced that they raised $80 million in capital in the form of a 6-year loan on Tuesday.
Well, I listened. This is the first one of the day, and I listened to this one, right? And I was laughing. You met Tori when you came in?
Yes, I did.
She's very, very nice, as opposed to German Mike.
Yeah, horrible,
awful, terrible
yeah,
person.
Can't stand him.
But Tori went today to go get her wisdom teeth. She was having pain in her wisdom teeth, and this guy, he starts off their painkiller drug. He says the way they do trials for it is when college kids are having their wisdom teeth out, they give them this drug, right? Versus a placebo. And I thought, that's clever, right? The college kid probably picks up $50 or $100, right?
That's
and
right.
You say like, oh my God, it's not working, or hey, this is good, man. I'll get some more wisdom teeth out next week. But I thought, what a clever way to do things.
I think it's great.
That's neat
Definitely.
stuff.
It works for both people,
Yeah, wonderful.
We also have Peter Lawrence, Peter COO of Arcule, and that's ticker ARQL, talked about the company's c-MET inhibitor program, ARQ-197, which he said has demonstrated broad anti-cancer activity. Phase 2 programs are underway with ARQ-197 for MIT tumors and pancreatic cancer, and are planning trials in prostate and gastric cancers as well. They are validating strategic partnerships with Kiowa and Roche and expect 1 to 2 INDs in 2008, Doug.
Yeah. The exciting stuff with these guys, right? I was listening to this one, too. A lot of this stuff we're going to need your medical background for because it flowed right over my simple head.
I'm your girl. I can help you.
Fantastic. I know that it all sounds good, and I know partnerships with Roche, right, are wonderful. I think that's like the biggest thing that the biotechs are looking is to get like one of their compounds far enough along so that they get a good partnership with somebody with some deep pockets.
Yes.
And then also, not only that, but once it's approved, they have their 50,000 salesperson army that's already in all the doctors' offices,
deep
ready to get out
and
there.
Credibility as well, too, and they have it, that's for sure. We have Timothy Claxon. Timothy Claxon is PhD, SVP and Chief Scientific Officer of Ariad Pharmaceuticals, and that's ticker ARIA. He discussed the new compound AP24534, which is entering into phase 1 trials for hematological malignancies and solid tumors. Deforolimus has entered into phase 3 Succeed trial for sarcomas with potential for being first-in-class mTOR pathway inhibitor for sarcomas and endometrial cancer. Ariad is aiming to leverage their relationship with Merck in their work on deforolimus.
Yeah, I know. I just finished this one before you came in, and it's awesome. They have the partnership with Merck, and they just got a $75 million upfront payment, and then they said they have some other serious, substantial milestone payments coming from Merck.
great. That's great.
You know, so that'll keep them, you know, nice and afloat while they're working these things through.
And
they got fast track status, you know.
Yeah, and to regular people like watching this, $75 million. I mean, you know, it sounds like a lot of money, but when you're in the, you know, the drug industry.
First, we're New Yorkers, so it's really not that much anyway.
You know. Your place costs that alone every month, right? Okay.
German Mike spends that a month. But anyhow, just with Singapore Air and Swiss Air. But to the rest of the people that aren't German Mike, it is a lot of money. These guys, their burn rate, he said last year's burn rate was $41 million, and they expect this year's to be about the same, right? Mm-hmm. So they pick up $75 million, and it said they had $80.2 million in cash to start I think at the end of the first quarter.
Yeah, I think so.
Right. Yeah. So, you know, they're in pretty good shape, and they got fast track status in 2007 from the FDA for the one that they're working on, right? And they have Merck already aligned and sending in funds, so it all sounded pretty good to me. I get excited with the biotechs. I think everyone is going to do what is going to be the big one. I'm holding on now to Aspen Bio, who we webcast a lot, who we're doing from Monaco in 2 weeks.
All right. You going to be there?
No.
German Mike will be, I'm sure.
No, German, he'll be here with me overnight. Yeah, he'll be here. But at least nobody bugs us then, right? German, we don't mind the overnights. It stinks coming in at midnight, but at least when the phones aren't ringing, the emails aren't going off.
I'm up on that.
Are you?
Yeah.
Yeah, German owns some. I didn't know you owned any of that. Yeah, I'm not. I'm down $1,200 on them. But that's going to be an all or nothing. You know, not all or nothing literally, but if this gets all the way through and they think it might be third quarter of 2008, it's going to be out of the park, you know. And if not, they've got the deals with big name companies for some of their other products already that are for, I believe, veterinary care. And smart people, we see them at the conferences, Roth and Rodman and that kind of thing. And that's the show. That's the Sherry show.
That's the deal. It is the Sherry show, and we're here every day.
I was well behaved. You got a nice soft entry.
You were totally well behaved. I was really impressed. I'd heard bad things.
Feedback.
I'd heard bad things about you, actually.
They're all true.
I was impressed.
And the things you hear just with the libel lawyers let slip out. Click the feedback button. If you own these companies, God bless German Mike for reminding us. If you own these companies, click the feedback button and tell us what you think about them. If you own competitors, click the feedback and tell us what you think about them, and let us know what you're doing with them. Awesome.
Definitely.
Thanks for your help.
Yeah, thank you for having me today. And we're here every day at Wall Street Media. You can also find us directly online at WSMCO.com. It's Sherry. This is Doug. Have a great weekend.